For the most part, the mainstay of treatment for kidney cancer has been VEGF-targeted therapies with drugs like sunitinib and pazopanib. But recently there's been breakthroughs with the approval of Nivolumab for advanced renal cell carcinoma. Now, Nivolumab was studied in a pivotal phase 3 trial and compared to Everolimus in patients who had progressed on drugs like sunitinib and pazopanib. The primary endpoint of the trial was overall survival, and the primary endpoint was reached, showing a benefit in overall survival for Nivolumab compared to Everolimus, and establishing it as a new standard of care in patients who had progressed on sunitinib or pazopanib. The other endpoints we looked at were response, and there was a higher response rate associated with Nivolumab compared to Everolimus. But what's most noteworthy is, in addition to the high response rate, many of the responses were durable, with the average or median duration of response of 12 months at the time of the data analysis, and many of the responses were continuing at that point. We also examined progression-free survival, and there wasn't an improvement in progression-free survival over Everolimus. I think there's probably a couple reasons for that. One is this phenomena of pseudoprogression, where sometimes the tumor actually gets a little larger. And the other is the mechanism of immunotherapy is different than that of VEGF-targeted therapies, and so some of the responses may be later, or some of the benefit may be in a group of patients who achieve a long-standing response rather than the majority benefit by progression-free survival.